Ladies and gentlemen, my name is Dr. Richard Hawkins and I'm a consultant radiologist at Leighton Hospital in Crewe. I would like to thank Canon and the ESR for inviting me to speak at this session and to share with you my excitement at how artificial intelligence is revolutionizing image quality and dose reduction in CT. Our journey into the world of deep learning CT reconstruction began when our oldest scanner was replaced in the summer of 2019 with the Canon Aquilium 1 Genesis edition. Crucially, it was equipped with AiCE, Canon's revolutionary new deep learning reconstruction technology. So to understand this better, let us quickly recap the history of imaging reconstruction. First came filter back projection. This was fast because it made many assumptions to reduce computing power, which was scarce, but it also gave the highest doses. Because it has been around for so long, these images are what most radiologists know and prefer to look at. Next came hybrid iterative reconstruction. This appeared in the mid-2000s as it required more computing power. It produced significantly lower doses, but the images had a different waxy look to them, and therefore it was blended with filter back projection images to make them look more acceptable, hence the hybrid tag. Next came full model-based iterative reconstruction. This gave very low doses indeed and much higher image quality by modeling every aspect of the imaging chain, but this needed vast amounts of computing power, so the process was very slow. For example, in the early days, it took nearly 2 weeks to reconstruct just one scan. Another issue was that the images looked plastic or as if painted by watercolors, particularly in the abdomen, and many radiologists disliked this. So the golden triad of high quality, high speed, ultra low dose CT imaging has been an elusive dream for a long time. Previously, only 2 of these 3 parameters could be achieved at once. That is, until the advent of deep learning reconstruction in the form of AiCE, when finally everything became possible. This was revolutionary and a turning point in CT image reconstruction. So what is AiCE? Well, AiCE stands for Advanced Intelligent Clear IQ Engine. As a radical departure from previous methods, it uses artificial intelligence to remove noise during image reconstruction and enhance the underlying true signal. And this was a world first for Canon. AiCE uses deep learning, a subset of machine learning, which itself is a subset of artificial intelligence. Deep learning systems do not need to be explicitly programmed, but learn a task through experience by being given lots of examples, much like a human learning a new skill. The key is the deep convolutional neural network, or computer brain, if you will. This mimics both the organization and operation of the human brain. Such systems have taken the world by storm in the fields of speech recognition and facial recognition, and are now being used in numerous of areas. So how does AiCE work? Well, there are 2 key stages, the training stage and the operational stage. The neural network is initially trained by showing it thousands of sets of matched images, one ultra high quality, the other low quality. Through the deep learning process and by millions of adjustments to its neural connections, the system teaches itself how to remove the noise from the low quality images and transform them into the high quality ones. This occurs under controlled conditions in a computer lab in Japan. When the system is considered to be optimally trained, it is fixed at that point and cannot learn anymore. The system is then shipped in this state and once on site switches to the operational stage, transforming the low quality ultra low dose data required into high quality images by removing the noise and boosting the true signal, just as it learned in the lab. You can see this more easily in pictorial form on this slide. AiCE differentiates noise from signal. It removes noise, preserves image texture, improves low contrast resolution, and improves spatial resolution. In addition, AiCE images have a more natural look to them than iterative reconstruction images, a look which is distinctive to deep learning reconstruction and seems to be much more acceptable to radiologists. Certainly so far, I've had no complaints from my colleagues. Now, huge computing power is required to reconstruct these images fast enough for everyday real-world use, particularly in the inpatient setting. Fortunately, the cost of high-end computing power continues to fall, driven by the insatiable demand from the gaming industry and the quest for driverless cars. Canon deliberately went into partnership with computer graphics giant NVIDIA to solve this problem. The solution? The AiCE server, a supercomputer inside your scanner, as all reconstruction on Canon systems is done on the scanner itself and not offline. The result? A staggering 71.2 teraflops of power from 8 high-end NVIDIA GPUs working in parallel. To put this in context, the brand new Xbox Series X has 12 teraflops of power, nearly 6 times less. So how does AiCE perform in the real world? Well, we were lucky enough to be one of the very first sites in the UK to use AiCE back in 2019. So our goal was simple, to push the boundaries, exploit the full potential of AiCE and prove its benefits. In fact, it surpassed all our expectations and has redefined what we thought was possible in CT, particularly in terms of image quality and dose reduction. More recently, in December 2020, amid the resurgence of COVID in the UK, we went live with our new inpatient Aquilion Prime SP, also equipped with AiCE. Image reconstruction is not as fast as the Genesis, but has proven to be completely robust on this busy inpatient scanner and still provides the same level of image quality and dose reduction as the Genesis. We've been very impressed by its performance, proving that this technology is affordable, accessible, and usable across the full range of Canon CT scanners, and not just exclusive to ultra-high-end CT. So let me take you through a number of clinical examples now to give you a glimpse of the capabilities of this groundbreaking technology. An obvious place to start, where dose reduction is paramount, is the scanning of children, and AiCE does not disappoint. Here is a volumetric CT renal angiogram on a 12-year-old with severe hypertension of unknown cause. The dose length product, or DLP for short, was only 10 milligray per centimetres, or 0.15 millisieverts, equivalent to just 7 chest X-rays, and less than the dose of a plain film. And here is a dual-phase trauma CT performed on a 7-year-old girl who sustained abdominal injuries after going over the handlebars of her bike. The DLP for the arterial phase was just 19.7 and only 32.2 for the portal venous phase images. That's a total DLP of 53.3 or 1.1 millisieverts, which is astonishing for a dual-phase study of this quality at this dose. Another of our initial targets was urological CT examinations, because CT KUBs and urograms are very common. A large proportion of the patients are young, and many will require follow-up scans accumulating dose along the way. So we developed what we like to call the ghost dose protocol, because the doses are just so incredibly low. Using AiCE, our mean dose of 78.5 is 82% below the UK national dose reference level of 440 and less than the dose of a plain film. So we would argue that the plain film KUB is now extinct, and it certainly is in our department. So here is a ghost dose CT KUB. The DLP is only 37.5 or 0.56 millisieverts, less than the dose of a plain film. On the left is the AiCE image, and on the right it's the same image reconstructed with filtered back projection. And you can see it's so noisy, it's completely unusable. Here is a follow-up series of CT KUBs. On the left is the ghost dose study with a DLP of just 67, and on the right, the previous study using iterative reconstruction on an older scanner with a DLP of 416. So on the same patient, that's an 84% dose reduction, yet the image quality is better. The ghost dose protocol has also been applied to CT urograms. Currently, we still use 3 phases, but despite that, our mean dose of 401 is 65% below the UK national dose reference level of 1150. And here's an example. Here's the initial KUB phase. On the left are 0.5 millimeter AiCE images, and on the right, 1 millimeter iterative recon images from the previous study on an older machine. And even at half the dose and half the slice thickness, the images are better. And here are the portal venous phase images from that same study. And last but not least, the urographic phase images. Now, bariatrics is another area where AiCE excels, and we're in the process of trying to quantify this more accurately. Now, here's a CT chest, abdomen, pelvis on a huge patient with a BMI of 69. The DLP of 1250 is exceptionally low for a full body examination of this quality on a patient this large. So on the left are the AiCE images, whereas on the right are the images reconstructed with filtered back projection. Once again, you can see they're so noisy they are unusable. Now, CT pulmonary angiograms are another very common examination, but during the pandemic, we've seen the numbers skyrocket. With AiCE, our mean DLP of 117 is 73% less than the UK dose reference level of 440. Here is a spiral CTPA performed on a large man with our new Prime SP. A saddle PE and COVID are clearly shown, and yet the DLP is just 109 or 1.53 millisieverts on a large patient. In fact, the recommended COVID protocol in the UK of an unenhanced CT chest followed by a CTPA is precisely what's required to produce sure subtraction lung perfusion images. And this has now become the norm on our Prime SP scanner. Here is one such study demonstrating florid COVID, but also a P in the right below, which is much easier to spot with the help of the perfusion maps. And yet the entire study, pre and post contrast, was performed for a DLP of just 77.7 or 1.1 millisieverts. Now, a special subset of CTPAs is those performed on pregnant ladies. With further optimization, we've driven the dose down even more, and our mean DLP of 29 in this group is 93% now, 93% below national DRL. So here's a volumetric CTPA performed on a pregnant lady. DLP is only 14.4 or 0.2 millisieverts. That's just 10 chest x-rays. Now, during the pandemic, we also developed an ultra-low dose CT chest and KUB protocol after advice was issued to scan the chest in patients presenting with abdominal pain because COVID fooled us so many times in this regard during the first wave. Now, here's one such study, and the DLP is just 98.5 or 1.48 millisieverts. That's 90% the national dose reference level of 1,000. Whole body imaging of this quality at such low doses was previously impossible in the inpatient setting. And finally, CT coronary angiography has come to the fore in the pandemic as a substitute for invasive cath, as many patients were deemed not suitable due to COVID. Here's an ultra-low-dose CTCA performed on the Genesis with AiCE. Despite a DLP of just 17 or 0.2 millisieverts, the image quality is superb. So hopefully I've given you a glimpse of what I truly believe is the future of CT image reconstruction. AiCE will continue to evolve. Version 2 is already here, and as one of the first UK sites to be upgraded, we're seeing a clear increase in image quality whilst maintaining ultra-low doses. And with more computing power, AiCE will become even faster and more sophisticated. But the images I've shown you don't capture the true quality of the images produced. The stills, you just can't appreciate it. You have to see them in real time. So I would encourage you to contact Canon for a demonstration or come to visit us, and we will give you a taste of the future. Now, finally, I'd like to say a huge thank you to all the team involved at Leighton, without which none of this would have been possible, and also to Canon Medical for their continued support. Thank you for your attention.